Other news, research in developing a vaccine to protect against breast cancer is yielding some very encouraging results. We reported this yesterday. A woman in Florida, the very first to take the shot, she had been diagnosed with a condition known as triple-negative breast cancer. That was back in 2018.
And since taking the vaccine, she hasn't had a reoccurrence. Here to talk about this is Dr. Ami Shah from Lurie Cancer Center at Northwestern Medicine. Dr. Shah, thank you so much for being with us today.
Thanks for having me. I'm happy to be here.
Now, before we get to the vaccine, can you talk about what does triple negative mean in terms of being diagnosed with breast cancer?
Yeah, triple negative breast cancer is a subtype of breast cancer that's characterized by not having the receptors or the antenna on the surface of the cancer cells for estrogen receptor, progesterone receptor, so it doesn't respond to hormones, or for the HER2 receptor. And so breast cancers that have this subtype, which is that 15 to 20% of breast cancers, they can be more aggressive. They can be tumors that respond better to chemotherapy and immunotherapy as their primary ways of treatment, but drugs like tamoxifen or Herceptin are not effective treatments. But despite the fact that this is an aggressive subtype, it's a subtype that does have a growing number of effective treatments. And although many of them are primarily based in chemotherapy, in the last several years, we've had meaningful advances in the use of immune therapy and antibody drug conjugates as other forms of treatment that are effective for this subtype of breast cancer as well.
Interesting. Okay, so Dr. Shah, tell us about this vaccine. My understanding is it's specifically for this type of breast cancer, but how promising is this to come online when it comes to cancer treatments overall?
Yeah, so I guess I'll first just start a little bit about vaccines and breast cancer is that the concept is very similar to how we think about normal vaccines. We get vaccines for viral infections or bacterial infections to try to treat our own body's immune system to better recognize pathogens that shouldn't be there. And cancer similarly shouldn't be there. And so our immune system should be doing the job of finding these cells, recognizing them, and tagging them to be destroyed, but it's not doing that properly. So the idea here is if we can find a protein that's unique to the breast cancer that's not seen in the majority of the rest of our body, then and teach our immune system to say that one doesn't belong here, then hopefully we can help our immune system work with us in terms of avoiding breast cancer recurrences. This specific vaccine is looking at using this protein called alpha-lactalbumin, which is expressed on lactating breast tissue, and outside of that in normal breast tissue and the rest of the body, we don't see it typically expressed, but it is expressed in the majority of triple-negative breast cancers. So hopefully, if the immune system is recognizing cells that express that protein and tagging those for destruction, then it can participate more actively in avoiding cancer recurrences. Currently, this research is still in very initial stages, so it has shown some promise in preclinical studies, and so this is now moving into the initial studies in patients. These phase 1 early stage studies are ones that are looking at trying to identify what is a dose that could elicit that is safe to receive primarily. That's the number one goal of this level of study. And then also seeing if at that level, are we seeing some activity in the right ways in the immune system as well. So this is kind of a first step in what hopes to be like a promising new chapter in strategies for treating breast cancer. But I think that we have unfortunately a number of steps to go before this could be really something that we can be offering our patients. But I think that this and other vaccine trials are reaching a new generation. Unfortunately, prior vaccine trials have not panned out. But as we have better strategies for immune therapy, for developing vaccines, we hope that these next generations of vaccines will be promising. And we hope to have similar trials looking at a vaccine in the HER2 setting upcoming here at Northwestern as well.
Okay, so we only have a couple of seconds, Dr. Shah, but if
Sure.
these trials continue to go well, what would be a realistic time frame on when it could get wide FDA approval?
I think that's still numbers of years out.
Okay.
We still have to confirm kind of the safety, the dosing, and then the last part is really just, is this really effective at preventing recurrences? And we still haven't demonstrated that in patients, but we're optimistic for the years ahead to have really better treatments to offer our patients.
All right. Thank you so much, Dr. Ami Shah from Lurie Cancer Center at Northwestern Medicine. We appreciate you for being with us today.
Thanks for having me.